Good morning, everyone. I'm Andrea Goodman from the Colorectal Cancer Alliance, joined this morning by longtime allies and AllyCon champions, Vanessa Ghigliotty and Howard Brown. Good morning, Howard and Vanessa.
Good morning.
Good morning.
It's hard to believe we're already on day 3 of virtual AllyCon 2021. And honestly, it's been amazing, but I'm a bit sick of doing this on screens. Seeing all of you again on Zoom makes me eager to see and hug everyone in person. But I'm grateful that we're able to do it this way, safely, and I want to thank you for hanging in there virtually. Hopefully, we're all comfy in our own homes and taking breaks as we need them. I also want to use this opportunity to send a big thanks to our team, Nancy, Val, Allie, Sam, Kim, Jamie, Stephen, our navigators and organizers, live events, our sponsors. It takes a lot of passionate people to make an event like this happen. Yesterday's sessions were incredible. How cool was that opening champions video? Let's take a minute, and I'm going to ask everyone to share in one word a feeling or thought or experience from AllyCon so far. So share one word in the chat. We're going to take a quick look. Family, love that, Shell. Hopeful. Community, leadership, togetherness. I love it. All right, I'm going to let you guys keep going, keep sharing your words. We couldn't always see each other, but I could tell through your words now and your words yesterday. There was laughing, crying, learning, and healing. And all of these experiences now are what makes up this strong community. So instead of recapping it myself, I'd like to share with you some quotes in your own words from the chat yesterday during various sessions. I'll start with the laughing. Brenda was great. I'm getting ready to get my chemo today. Good laugh before hookup. And the emotions. Things didn't hit me until over a year after being told NED because I finally stopped to process what I went through. I love how she keeps saying to not deny what you are feeling. That's what I always tell patients. It's harder to wear the happy mask for everyone than it is to just have a bad day and work through it. I'm sure that resonates with a lot of you. And there was a lot of learning and shared knowledge. Be your best advocate and have the conversation in a collaborative manner with your team. Neither my medical or radiation oncologist mentioned anything about fertility until I brought it up. And I love telehealth. I feel like I get much more attentive doctor than when I see the same doctor in person. So much great information today. And lastly, healing. Lots of people reconnected with each other and said they were sending hugs. So grateful for my blue family. I'm so hopeful that we're talking about new things that will save lives. And miss in-person hugs, but always happy to continue learning. So onward to day 2. I'm really excited to see what today brings. I just want to share that our photo contest ends today. So get your photos into the photo gallery by 11 a.m. Eastern time today. And before we head to our first session on health and wellness, I'm going to turn it over to Vanessa.
Hello, everyone. Good morning, and thank you for coming again. Day 3, our last day together. I just wanted to do a recap, and I know that we've had the most phenomenal program put together. This whole virtual conference, every panel, every session has taught us something new, exciting, less toxic treatments that are coming along, more sensitive testing that will help us to detect cancer earlier and in earlier stages, which is so exciting. And I think I'll leave that to Howard to discuss more in detail. But for me, I want to talk about day 1, and I want to talk about the Allies training that we had. And it was a special training for us active volunteers. And I think this is something that will help the whole community, every single survivor, caregiver, and thriver that's out there. And it's about our stories. Our stories is what moves mountains. Our stories is so powerful. And on day 1, we got to tailor our stories. We got to develop them and streamline them basically and get it down to the nitty gritty meat of it. And then not only did we get to tailor our stories and work together on this, not only with the staff, but with each other through breakout rooms, several breakout rooms, where we really honed in on what made our story unique and special. But we also learned how to tailor it to different audiences, whether it's to speak to your local politician to get him to sign on to increase funding at the NIH, or whether it's to go to your local journalist so that they'll run your story during March in order to hopefully inspire people to get their colonoscopies. We learned every single detail, and this is something that is phenomenal and amazing. And I think all of us can teach that learned in that session, could go on and teach our community and everyone in our colorectal cancer community how powerful and impactful their story can be. And with that, on day 2, we had, like I said earlier, the most phenomenal panelists, the doctors. I mean, the things that they were talking about, and I'm taking notes, and I just couldn't believe that this is what's happening now. And colon cancer is scary, but it is exciting what's coming out for us. And the difference between when I was diagnosed 19 years ago and what's happening now is truly so hopeful. And with that, in a breakout room, there was a newbie, which is of course my favorite, right? And I want to be respectful, and I'm not going to say her name, but she is a newbie, and she's treated at MD Anderson. And she, I get emotional. She wanted to meet a doctor, someone who she researched and empowered herself and learned everything about him, and thought Dr. Copette, I think I'm saying his name right, is someone that she wanted to meet so badly, and she couldn't get in to see him. And then he had a trial. She went for the trial and she didn't qualify. So she was disappointed, but he was on a panel yesterday. So not only did she get to hear everything that he had to say, which was phenomenal, but she was able to ask all the questions that she wanted to ask him in person. She asked right there in our Q&A section, and he directly answered every single one of her questions. If this is not an impactful and a bigger example of how important these virtual conferences are, I don't know what is. And I think this is something that all of us should really utilize, and realize that all the panelists and all the doctors, they're available. The Colorectal Cancer Alliance have made them available to us so that they can reach it. They will react with us. They will answer our questions, and they will help us with our journey.
Wow. Great setup there, Vanessa. Howard Brown here. And it was a really impactful day, these last couple of days, and I hope you took away a lot. This is all done for the benefit of the allies, the caregivers, the patients, the friends of the Alliance. We started the day after Michael's kickoff of a huge fundraiser at the Blue Hope Ball, raised $1 million. It's just so inspiring. But we put diversity and disparities and health equity on the table. No one needs to be left behind. We need more awareness, more screening and treatment for those minority communities. And really important to kick off the conference with that. Vanessa mentioned the hope part. ctDNA or liquid biopsy, circulating tumor DNA, if this doesn't give us hope that a blood test of the information that a tumor leaves, it helped me. 3 years ago, I had liquid biopsies, and it gave vital information to my oncology team and to my tumor boards. There is hope coming, and it's coming fast. Next, we really put something on the table. With cancer and COVID, our mental health, our physical health, our sexual health, it's now open for discussion. My big takeaway, it's okay not to be okay. There's help. The Alliance, there's help out there for us. And it's a lot to handle for us as patients and caregivers. Our worlds are just turned upside down. So it's okay not to be okay. And then lastly, it is so exciting to see that the patient and the caregiver are being put first. Research, clinics, industry, and pharma are now including us. They need us. We're breaking those silos. In order to get a cure of this disease, we need to come together, and we need each other. And it's exciting that the Alliance put the patient and the caregiver first and matched us with these docs, the industry, and our sponsors to make it all happen. And I'm so excited because next year we're going to be in person and we can hug, and hopefully we can maybe include a hybrid for those that can't make there. But AllyCon for me is like coming home to family, and family's got your back. And I just want to thank the Alliance for allowing this program. It's not easy to do, and great information that we can all use and move forward with as we forge ahead. Back to you, Andrea.
Thanks, Howard and Vanessa. All right, we'll see you all in a few minutes in the first session of the day.
Have a great day, everybody.